1. Medicine shortages, pharmacies at breaking point. 2. Medicine shortages, a growing concern for patients. 3. Addressing medicine shortages, the call for patient input. 1. Medicine shortages, pharmacies at breaking point. Medicine shortages are pushing community pharmacies to the edge, creating a crisis that affects both patients and healthcare providers alike. This ongoing challenge has been described as a distressing new normal by Community Pharmacy England, CPE, which highlights that the entire medicine supply chain is under severe strain and nearing a critical breaking point. The consequences are serious. Not only is patient health at risk, but pharmacy staff are also facing rising workloads and increasing stress levels. The 2025 Pharmacy Pressure Survey, conducted by CPE, reveals that a staggering 87% of pharmacy staff now deal with medicine supply problems every single day, a sharp rise from 67% in 2022. This extensive survey included feedback from over 4,300 pharmacy owners and 1,600 pharmacy team members, underscoring how widespread and persistent the issue has become. The organization urgently calls for immediate and effective action to resolve these shortages before they escalate further. This report builds upon earlier warnings issued in March by the Centre for Long-Term Resilience, which cautioned that the UK healthcare system is perilously vulnerable to interruptions in critical medical supplies. Notably, essential antibiotics, such as gentamicin, are among the scarce medicines, raising alarms about potential risks to treating infections effectively. In response to these persistent supply problems, serious shortage protocols, SSPs, have been expanded considerably. These protocols empower pharmacists to modify prescriptions by substituting equivalent medications or providing reduced quantities without needing a new prescription from doctors, but only for 1 month at a time. Over the last year, SSPs have been applied to several vital medicines, including hormone replacement therapy drug estradiol, psychiatric medications like quetiapine, used for conditions such as schizophrenia and bipolar disorder, methylphenidate for ADHD, critical antibiotics including cephalexin and clarithromycin, heart medications like isosorbide mononitrate for angina, and ramipril for cardiovascular disease. More recently, the government extended the SSP for Creon, a pancreatic enzyme replacement medication that's crucial for patients with digestive issues. The National Pharmacy Association, NPA, has reported worrying patient behaviors, such as rationing doses, skipping meals, or traveling long distances to obtain this medicine, highlighting just how desperate the situation has become. But here's where it gets controversial. While SSPs offer some relief, many argue they are not enough and could inadvertently delay patient treatment if implemented improperly. Is relying on pharmacists to substitute medications causing unintended risks? This is a question worth debating. The pressure on pharmacy teams is more than just a supply problem. It's also a human issue. According to the 2024 Pharmacy Pressure Survey, many pharmacies have become battlegrounds where patients, frustrated by shortages, often direct their anger towards staff. The most recent CPE findings are sobering. 96% of pharmacy workers have experienced patient frustration due to missing medicines. 86% of pharmacy owners say patients must visit several pharmacies to find what they need, and 79% report experiencing aggressive behavior from patients when their medications are unavailable or delayed. Supply problems have only intensified. 80% of pharmacy owners report facing daily shortages from wholesalers, with 26% encountering supply chain failures every day. This leaves pharmacy teams scrambling, with 74% spending more time than ever searching for medicines. Nearly 40% report dedicating 1 to 2 hours each day just sourcing alternative options. Unsurprisingly, over 90% of staff say these issues have led to greater workloads and heightened stress. Janet Morrison, CEO of CPE, summed up the grim reality. These recurrent medicine shortages are no longer rare disruptions. They have become an everyday challenge that endangers patient safety. She warns that the system is stuck at breaking point, unable to cope with the continuous strain. Adding to the chorus of concern, Olivier Picard, chair of the National Pharmacy Association representing over 6,000 independent pharmacies, emphasizes that pharmacists are bearing the brunt of these shortages. He calls it madness to force patients to return to their GP just to have a prescription changed when pharmacists have safe alternatives in stock. Such delays could lead patients to skip essential medication, which is a direct threat to their health. Picard strongly supports increasing pharmacists' autonomy to make professional judgments in supplying suitable substitute medicines when the prescribed ones are unavailable, a move the government must consider seriously. Louise Ansari, CEO of HealthWatch England, echoes this viewpoint, advocating for greater pharmacist flexibility and patient consent-driven substitutions where clinically appropriate. She stresses the importance of clear public guidance on how to proceed when a prescribed medicine is not available, which could significantly relieve pressure on patients and healthcare services. This complex landscape begs a crucial question. Are current policies empowering pharmacists enough to safeguard patient health amid these shortages? Or is the system still too rigid, putting patients and pharmacy teams at unnecessary risk? What do you think? Share your thoughts below. Do you agree with expanding pharmacists' powers, or are there potential dangers in loosening prescription controls? The conversation is vital as we navigate these challenging times. Dr. Sheena Meredith, a seasoned medical writer, editor, and healthcare communications consultant, brings her expertise in medicine, law, and medical ethics to illuminate these pressing issues for both medical professionals and the public. 2. Medicine shortages, a growing concern for patients. Widespread medicine shortages, a growing crisis endangering patients. Patients are increasingly at risk due to ongoing and extensive shortages of essential medications, as highlighted in a recent report by members of Parliament, MPs, and peers. The All-Party Parliamentary Group, APPG, on pharmacy has urgently called for immediate measures to prevent these critical shortages from becoming a regular occurrence. They specifically pointed out the detrimental effects these shortages have on individuals suffering from conditions such as ADHD, menopause, and diabetes. Steve Race, the chairman of the APPG on pharmacy, noted that many MPs have been inundated with messages from constituents who are understandably worried about the availability of their necessary medications. Whether it's a parent struggling to find antibiotics for their ill child, an elderly individual facing delays in receiving life-saving treatments, or a pharmacist overwhelmed by the demand for alternative solutions, the human toll is both apparent and deeply concerning, he stated in the report. The report emphasizes that while medicine shortages are not a new issue, they have escalated in severity, persistence, and disruption in recent years, leading to significant repercussions for patients, healthcare staff, and the broader health system. These shortages have transitioned from isolated incidents to a chronic structural issue affecting both the NHS and the pharmacy sector, Race explained. He further stressed that as the government acknowledges and invests in the expanded clinical roles of community pharmacies, it is crucial to ensure that the supply chain for medication supporting this care is equally strong, resilient, and focused on patient needs. Pharmacy plays a vital role in the recovery and transformation of the NHS, but frontline teams cannot safely broaden clinical services while they continue to face daily disruptions in supply that affect patient health, he added. The findings of the report also underscore the severe impact of shortages on patients with conditions like ADHD, menopause, and diabetes. According to an APPG survey, over 90% of pharmacists, general practitioners, GPs, and prescribers reported that ADHD medications have been affected by shortages. Approximately 76% indicated that hormone replacement therapy, HRT, and diabetes medications have also been impacted, while 44% noted shortages in antibiotics. One ADHD patient shared with the inquiry that they resorted to self-medicating with cannabis due to the ongoing unavailability of methylphenidate. The report stated, these shortages significantly hinder patients' access to treatments and, in some instances, have serious implications for their health and well-being. Mr. Race emphasized, ensuring the security of medicines must be regarded as a fundamental aspect of NHS planning, alongside considerations for funding, workforce, and digital infrastructure. Neglecting to address this issue risks further compromising patient care and destabilizing a community pharmacy sector that millions rely on. The APPG has proposed several recommendations aimed at enhancing support for patients. Individuals affected by these shortages, especially those with chronic conditions, often find it challenging to obtain information about out-of-stock medications, leading to frustration, dangerous delays in care, and unnecessary anxiety and harm. The report also welcomed initiatives by the Department of Health and Social Care to potentially revise pharmacist prescribing protocols, allowing pharmacists to adjust dosages and formulations during shortages. Additionally, the inquiry revealed that over 80% of pharmacists encountered daily shortages, with many dedicating hours each day to finding alternative treatments and communicating with distressed patients. One pharmacist described their experience to the APPG as constantly firefighting. In response to the report, Henry Gregg, the chief executive of the National Pharmacy Association, NPA, remarked, "Pharmacy teams are under immense pressure and are compelled to spend hours searching for stock for anxious and frustrated patients. It is particularly disheartening for pharmacists to be unable to fulfill a clear need when they have a safe and effective solution readily available in their pharmacy." MPs are correct in stating that it is absurd to send someone back to their GP for a prescription change, as this risks delaying vital medication or causing patients to forego it entirely, which poses a significant risk to their safety. As the APPG suggests, the government must empower pharmacists, who are highly trained healthcare professionals, to use their expertise to provide suitable alternative medications when the prescribed ones are unavailable. A spokesperson for the Department of Health and Social Care stated, "This government has inherited ongoing global supply challenges, but we have implemented robust measures to minimize disruptions for patients. We are committed to strengthening the resilience of medicine supply chains and preventing future disruptions as we work to restore the NHS." Recently, we have secured an additional £617 million in funding over 2 years with Community Pharmacy England to support the sector and offer patients more services closer to home as part of our 10-year health plan. 3. Addressing medicine shortages, the call for patient input. Medicine shortages in the UK have escalated from occasional hiccups to a full-blown crisis endangering patient lives daily. A reality confirmed by staggering new data showing 87% of pharmacies battle supply issues every single day. Shocking? Yes, but here's where it gets controversial. A landmark parliamentary report reveals that economic interests consistently trump patient welfare in current policies, creating dangerous inequalities. This bombshell finding has triggered urgent calls for patient voices to finally shape solutions. The All-Party Parliamentary Group, APPG, on pharmacy unveiled 12 critical recommendations in their July 2025 report, demanding a complete overhaul of how the UK handles medicine shortages. At the heart of their proposal, creating a national patient advisory panel to inject first-hand experiences into policy decisions. This panel wouldn't just offer token input. It would actively evaluate shortage impacts and co-design emergency contingency plans, forcing the system to prioritize real human needs over spreadsheets. But that's not all. The APPG pushes for radical changes like allowing pharmacists to make immediate dosage or formulation substitutions during shortages, a move empowering frontline professionals to bypass bureaucratic delays when lives are at stake. They're also demanding a full independent review of the fractured UK medicines supply chain and patient-centered local pathways. These pathways would unite GPs, community pharmacies, and specialists in coordinated networks, ensuring no one falls through the cracks during medication droughts. The evidence is damning. A Community Pharmacy England survey of over 4,300 pharmacies exposed that 73% of staff witnessed direct risks to patient health from medicine delays. As Steve Race, APPG chair, starkly warns, Shortages are now a chronic structural crisis undermining the entire NHS. Pharmacy leaders unanimously echo this alarm. Janet Morrison of Community Pharmacy England states, "Current inaction is simply unacceptable," while Malcolm Harrison of the Company Chemist Association stresses that without end-to-end supply chain reforms, patients will keep suffering. Most provocative of all, Henry Gregg of the National Pharmacy Association reveals these shortages now pose serious risks to patient safety, a chilling reality check. Here's the uncomfortable truth the report forces us to confront. When economic calculations systematically override patient welfare, who really pays the price? And with pharmacists still barred from making common-sense substitutions during emergencies, are we prioritizing red tape over real people? Now it's your turn. Have you experienced dangerous medication delays? Should pharmacists have more autonomy during crises? Share your stories below. This debate affects us all.